thank you for your grace and your mercy. In Jesus' name, amen.
Amen.
Thank you very much. All right, normally we would have minutes from previous meeting. Our previous meeting was our swearing in, and there were no minutes. If you would like to go back and look at the swearing in, you can go to our website and it is posted. We're also deferring the treasurer's report for the next meeting because our treasurer could not be here tonight. And we're going to thank Laura Luckenheimer for hosting us, and we'd like to have you say a few words about Peaceful Schools.
Hi, welcome everybody. So glad you're here. A couple logistics in case you need a restroom. They're right down the hall, and there's 2 restrooms to your right as you go down that hallway. There's waters. If you need anything else, please ask me. Welcome to our space. Peaceful Schools has been in Syracuse since 1997. So last year we celebrated our 25th year serving the Syracuse community. And we actually, our programming and our partnerships now stretch from Buffalo to Long Island. We are a mighty team of about 79 staff, primarily here. Syracuse is our home and is the community we love and want to serve. So we work closely. We're currently partnered with 9 Syracuse City School Districts in different capacities, but we also work with Solvay. We have an incredible partnership with Fulton and Central Square, and we have some new partners in Wayne County, and again, up and down the thruway. So there's a whole lot. I want to hear from the panel tonight. There's a whole lot that we do, and we'd love for you to learn more about us. I left a card on our front desk on your way out. If you want to learn, there's a QR code that takes you to our website. And if you like our space, we do rent it out for professional use. We're really excited to share. It's a good location. It's easy to get to. Hopefully it was easy for y'all to find. So check us out. But I'm so glad you guys are here, and I'm really looking forward to hearing from tonight's panel.
Thank you.
Thank you.
Okay, I am going to introduce our moderator for this evening, who is Latoya Jones. Latoya is a Syracuse native. She's a nurse who has maintained an impressive career in the healthcare industry for more than 28 years, building a reputation as a change maker in health policy, public health, and disability advocacy. She currently serves as a regional healthcare organizer in Central New York and the North Country. Ms. Jones is passionate about decreasing the rate of healthcare disparities in the community and is a staunch social justice advocate, influencer, educator, volunteer, and promoter of holistic wellness. She is one of the 3 co-chairs of the CNY Regional Healthcare Equity Task Force. She leverages her talents as a coalition builder and social change agent through her active participation in a number of organizations. She's the founder of the Joe Family Foundation for Disability Advocacy. She serves on the boards of the Health Foundation for Western and Central New York and is active in the iMobile Health Mission. Ms. Jones also is an occupational health clinic advisory member and serves on the Black Equity and Excellence Fund Advisory Council. She is a member of Lambda Kappa Mu sorority, and in 2017, she was inducted into Alpha Beta Gamma. She's a delegate of the Greater Syracuse Labor Council. She graduated from Bryant and Stratton College, earning a Bachelor of Science in Health Service Administration. She is pursuing her master's degree in public health and will graduate in the fall of 2023 from Grand Canyon University. Ms. Jones plans to obtain a doctorate, thus further expanding her work with the Healthcare Education Project. Thank you.
Thank you, Gwen. Welcome everybody, and thank you guys for having me today. I want to start off saying that many of us pay attention to our physical alignments, but we often forget about our overall wellness, including our mental health. Mental health involves our emotional, psychological, and social well-being, which affects how we feel, think, and act. If you're struggling with a mental health illness, know that you're not alone. Today, I want to welcome our panelists that are joining us today. I want to start off with introducing Novelette Pierce. She was born and raised in Syracuse. Novelette Pierce is a licensed master social worker with more than 20 years of experience in human service, mental health field. Her work has ranged from counseling and youth programming to research analysis and community education. Currently, Ms. Pierce is the Director of Mental Hygiene Services for Coordinated Care Services Incorporated, supporting mental health initiatives and system development for Onondaga County. Department of Children and Family Services. In addition to her primary position, Ms. Pierce also is a national trainer for the National Council of Mental Wellness in Washington, D.C., training people to become instructors for youth mental health first aid. She earned a master's degree in social work from the State University of New York at Albany and a bachelor's of science degree in human development from Cornell University. Let's welcome Ms. Pierce. We also have with us this evening Tatiana Williams. Tatiana Williams serves as a clinical director at a certified community behavioral health clinic in Syracuse. She is licensed clinical social worker who has been involved in the community organizations and leadership and advocacy since 2007. Ms. Williams is actively engaged in community, clinic, and private practice, social work, and mental health leadership. She has dedicated her career as a millennial therapist and supervisor to cultivating the clinical skills and strength of the next generation of therapists, and to making therapy more relatable and accessible for BIPOC and youth. Ms. Williams has received multiple honors for her work. She received the Princeton University Prize in Race Relations in 2012, numerous awards for scholarship and service from Syracuse University, and in 2016, the YWCA's Volunteer of Excellence and Service Award. She is a graduate of Syracuse University undergraduate and master's degree and program in social work. Let's welcome Ms. Williams. Today with us, we also have Dr. Sunny Islam, who is an addiction psychiatrist and director of psychiatric and addiction services at Syracuse Community Health Center, a federally qualified health center. Dr. Islam splits time working at Syracuse Community Health as an activist fighting poverty and as a father to daughters Aisha and Haya Rose. He was named the top physician in Central New York in 2018, honored by the County Medical Society for Physician Service to the Community in 2019, and earned the SUNY Upstate Leonardtown Humanitarian Award in 2020 for clinical excellence and outstanding compassion in the delivery of care. Dr. Islam is also a member of the Syracuse Onondaga NAACP. Let's welcome Dr. Sunny. So we're gonna start the panel off today by asking each panelist a question. I would like you all to talk about what you see the mental health crisis is in our community, and we'll start with Ms. Pierce.
Okay, I'm not even sure, I prepared correctly because I was thinking, we all know that our children are suffering. I was asked to speak more to what's happening with young people. Just to give you a little picture of some numbers, the Child and Adolescent Psychiatric consults up at Upstate Golisano Children's Hospital were about 200, they had about 200 of those consults in 2014. By 2019, it was close to 2,000, and it's closer to 4,000 after the pandemic. So that shows like kind of the rising when we think about the young people who are seen in an emergency room. A lot of those had to do with suicidal ideation and suicide attempts. So that tells you a little bit. In our schools, they do a lot of assessments of how our young people are doing across different social emotional levels and areas, and they have seen increased numbers of suicidal ideation when they're doing those assessments in schools. So we can kind of see that we know that our young people are suffering. So I want to talk a little bit about some of the why and not just, the numbers that are out there. For one, I know we feel like we're coming out of the pandemic, but we're still seeing a lot of the effects of it. So one is the pandemic. There was a lot of social isolation during the pandemic, and that is hard for young people who are social, and that's how they learn and that's how they grow. So even though that we're coming out of it, there are a lot of activities that are just now getting back started. Even when we think about our meetings that we're here, this meeting, 6 months ago would have been virtual. And so kind of just getting back to some of these in-person things. So that is social isolation for a long period of time for young people. So even though they were back in school, some of their activities still weren't up and running. Some certain things were not happening where they got to be social. While we were in the pandemic, a lot of things were happening online. All their school was online, activities were online. The more time that they spend online, sometimes they're more susceptible to negative things that are happening online, like bullying. And bullying is looks much different for them than it looked for us, because there's no safe space that you can go to. If it's online, it's ever present. And so it's having some of that increased negativity that was happening online. There was fear of personal or family sickness, wondering what's gonna happen. Is someone gonna get sick? Is someone going to die? And then there was actual loss from death. So some of our young people lost family members. We didn't lose a lot of young people themselves, but we still had a significant number of deaths in our community, and there were young people in their families. So they were being affected by that grief as well. Another reason is national trauma that, it's always been happening, but it seemed like right at the time that we had a pandemic, it increased national trauma as well. So we're thinking about police-caused deaths, thinking about political upheaval happening, thinking about mass shootings. So all of this stuff that is happening nationally that they see, even those who might not have parents that are in front of the news all the time, there's no way to escape hearing about some of these things. And the last reason is some of the local trauma that we've been having here in Syracuse and in the Onondaga County community. We all know about the housing crisis. It is affecting every program, I'm sure, that any of us work with, that people are having a hard time having a place to live and are unhoused for periods of time, and that includes families with children. We've had increased numbers of both suicides and homicides in our community, and so that is something that young people have been exposed to. We've had a lot of accidental deaths, meaning by car accidents and fires. The increased number of drug overdoses, so we hear that as well. And all of that equals to not feeling safe for young people. And all of these things lead to increased depression and anxiety. I didn't want to leave on that note, so I thought I added some what can we do. And so just a couple of things of have open conversations that are age appropriate. Don't be afraid of hard conversations. Allow young people to express their feelings. Learn the signs of when it is getting to like suicidal ideation. Take a QPR class. Learn the signs of when a young person is struggling. And don't brush off concerns or feelings or signs that something is wrong. So I hear adults say, yeah, something seems off with them, but they'll be all right. They'll come around. It'll get better. They just need to get back into, this or that. We don't want, as the adults in the young people's lives, not to brush off anything that they might be feeling. Increase their support network. So what happened during the pandemic is we had to narrow our circles for our physical safety. And so some people aren't moving those circles back out again. And it was just, hey, it's just this in our neutral family, our family right here. Well, now's the time to start getting back with more family, more neighbors, more people, so that even though, we still have other safety issues, that having to keep your circle so small makes your support network smaller. And so we need to start expanding it again for young people. Utilize the resources that are out there. So knowing about the programs that are in the schools, like Peaceful Schools, knowing about the clinics and we have 7 clinics, outpatient clinics that are here, so know about the resources that are available, what other programs that are out there. And last but not least, adults, get help for your own mental health, because kids pick up on what's happening with the adults around them.
Thank you, Mrs. Pierce. Dr. Sonny?
So I brought a ton of statistics and things like that, but I thought I just would share with you guys a little bit about what my experience has been at the health center. And so I started at the health center. There was like nearly a year-long waiting list for mental health appointments, and it just person after person would call and people wanted appointments, and so we moved to a walk-in system. And so we've really tried to change things to make things more accessible. We not only do we have walk-in hours, but we also, believe it or not, we hired a Black therapist. It makes sense. The people want to see people who look like them, right? And over again, people would ask that. But we're still recruiting for other therapists. We want. We want to provide treatment from people that look like, about 50% of our patients are African American, about a quarter are folks, basically brown folks from other parts of the world, Latin folks, and then about a quarter of our patients are white. And what we found was kind of interesting that when we went to walk-in hours, we started seeing some upper middle class people coming, because even upper middle class people, they can't find good care, they can't find accessible care, and so. It's been kind of eye-opening. I mean, I really appreciate the comments about children, adolescents, and families, because they're coming too. We have school-based clinics. We have 4 therapists that cover 8 schools. And so there's this huge need. We have unfilled positions, and it never ends, right? It's very difficult, and we expanded to seeing from people with some of the most debilitating and serious chronic illnesses like schizophrenia, people who are actively hallucinating and psychotic, and of course addiction. Addiction is a big driver of mental health problems, and even stepping back from all of that, I brought in a chart about adverse childhood events, which is what drives mental health problems, what drives medical problems, what drives addiction, and adverse childhood events, poverty itself, right? So during the day I'm a shrink, but the rest of my time I spend talking to people about poverty, understanding poverty, and how do we deal with poverty in other parts of the world that do a much better job than what we do in this country. Why does Norway's poverty rate 4% and ours 17%? I mean, it's obscene in a country with the amount of wealth we have, right? So there's for me, after so many years of doing this, part of my job since I've been in town, one of the first things I did was go to the free medical student-run clinic in the basement of the Civic Center. It's not there anymore, but that's just been where my heart is working with the poorest folks and walking the streets. So I've been a street psychiatrist for much of this time, and working with people who can't or won't come to clinics. So we'll go to them. We have our crew, and we go to them because some folks, particularly with schizophrenia, they may not even understand they have schizophrenia. So if you see someone walking down the street talking to themselves and looking, and they're usually very, very poor as well. So there's all these factors that come together in driving the mental health crisis, because it is a crisis. And what we see is just this tremendous need. And so when I started, we were seeing about 450 encounters on average before I got to the health center. We hit 1,800 last month. So in the space of less than a year, we've quadrupled the amount of encounters we have, because there's just this crushing need of person after person coming in. I have local professors that I see to people who are homeless. You see the whole range of people there, because I believe because we're so accessible and because we provide good care there. We have people who've been there. Dr. Hines, some of you may know, has been there about 30 years. Stephanie Montgomery, our manager, has been there 30 years. They've seen everything. They've seen it all, and they know how to run the clinic, and they do a great job. So I do want to finish also on a positive note that I'll just share with you. In my family is we have addiction, we have mental health. I've been in treatment myself for most of my life. I still go to psychotherapy, and I share this with patients when it's appropriate, because often there's big stigma, particularly in the African American community, in the Indian community. We don't talk about mental health. You know, we don't talk about my aunt who had schizophrenia and died getting insulin shock treatment. We don't talk about I have cousins who are addicted, right? You know, and it's just not talked about. And so a lot of times people will come in and they're like, "Are you going to lock me up?" You know, there's like, and like those things have happened, right? They really have happened where, you know, a psychiatric inpatient unit in the hospital is literally a locked unit. You cannot leave. You can't just freely leave. You know, I call it a form of imprisonment. I do whatever I can to keep my patients out of the hospital because I know how afraid people are. I don't want to be locked up. You know, they don't want to be locked up. So a lot of what we do is educating and sitting with our patients and just sharing a little bit with them. You know, I understand you don't want to come to psychotherapy. It's really hard work, but I go myself. You know, I have to go to take care of myself. And so I just wanted to finish with sharing a resource with you guys that I have, again, this is a group I go to. There's a 12-step group for people from dysfunctional families, for adult children from dysfunctional families. Anybody who wants to work on their relationships can go to it. And it's free. And it's so the website is adultchildren.org. And I refer almost all my patients to it because it's anybody who's serious about improving their relationships, understanding their own trauma, their own family issues. It's a free resource, and they have virtual meetings. And they have face-to-face meetings locally too. So you can do it from home if you want, or you can actually go to the meetings Tuesday at the Eastwood Baptist Church. It's not a religious group, it's just a site where they have the meetings. 12-step meetings are not affiliated with any religions, but it's a free resource that anybody could go to, adultchildren.org. I encourage people to check it out, and you know, maybe I'll see you at a meeting sometime.
Thank you, Dr. Sonny.
I just want to make one point quickly. The point you made about the wait time, that's a really good realization, and it's not unique to upstate New York. Like, I've worked across the states, in different states and different countries, and it's exactly that way, and it's that way with most insurances. Even if you have one of the best insurances, the wait time to get in with a therapist, unless you're saying, I'm gonna kill myself, is at least 1 month, and that is just unacceptable. And the only time where I've called and said, hey, I want an appointment, they're like, okay, let's get you in this week, was when I was paying out of pocket. In a country, like, that's just unacceptable.
Agreed.
Healthcare is a basic human need, and it needs to be accessible. And I love that, you know, we're catching up to it now, and more people wanna focus on it. Because this world and this country is wealthy. God has given us the resources. It's just us humans get a little, you know, unfocused and like don't see what's right here. So I love that, you know, you made that recognition and you took solid steps to, you know, address it. And I think that's something that, you know, the rest of the country is doing at some point, but it should be more widely practiced because we need this.
Thank you. Ms. Williams?
First of all, excellent point that you just made right there. And I just want to start off by saying that mental health does not discriminate at all, but the systems and some of our processes that we've had for ages has. And so we are also catching up and recovering from systematic racism, poverty and how it's impacted, how we've ultimately isolated folks by nature of our systems and processes. And so that has to catch up. And having that perspective of mental health, behavioral health, physical health being a basic human right, and our government providing, you know, what is needed for that, for everybody, and not discriminating. So great point. And one of the things I just want to echo, and it actually ties off of what you just said too, is the access piece, y'all. It is our mission to make sure that we are available, that the doors are always open, that people can access care. But I have to be very transparent right now and speak about the reality. To keep doors open and to keep care available for people 24/7, my agency has offered 24/7, round-the-clock access to care. We have to have people to hold the door open. So there have to be staff. And there's a huge staffing crisis and shortage, just as much as there's the mental health and behavioral health crisis as well. There are not enough people with the backgrounds, the degrees, and the education to provide the care right now. We are seeing that the cohorts of folks going into programs like social work, psychology, mental health counseling, marriage and family therapy has dwindled. Their classes have shrunk since the pandemic. And so the future is looking a little bit bleak. We're experiencing some of it now, but there's also the knowing that there's going to be another wave of it coming based on no large cohorts of students coming out of school. So we need to inspire people. I'm going to speak a little bit about inspiration and the power of purpose, because it sounds like you've done a great job of summarizing like what is happening, what the issue is, but then also how do we get people, first of all, interested in the field. And we just have to acknowledge that mental health doesn't discriminate, which means that the people that are serving folks are also experiencing the same issues. That's really important to acknowledge. And what trauma tends to do, one of the ways that we cope with trauma very naturally, very instinctively, is to isolate and to avoid. And so the healing process has to be the antithesis of that, which means coming together and going right in. So being direct, having open conversations like you just acknowledged, like making sure that we're not avoiding talking about mental health and well-being, acknowledging that all of us have some sort of experience with it, that we're all living in a really traumatic society right now. And so just having those very open conversations so that people feel safe. We have to reduce the stigma first and foremost for everyone, which includes the people that would be providing care. And then the next piece I would say as well is coming back to a sense of purpose. What are we here for? What are we doing? And so also acknowledging that mental health has been very much so focused on evidence-based practices, which gets very logical, reason-based, and they're ultimately practices that have evidence that prove like if you do this, this outcome will happen. The thing is, there's limited research on those working across populations. They demonstrate that some populations it works well with, but there's not always enough research to support race aspects. Like, does this work with our young people, number one, or our young Black people, number two? And so and the reason that they don't have the research to support that is because it doesn't reach them. So we can't test it to see if it works because that's not how you get to them. And so having a more creative approach and inspiring people, reminding them of their purpose. Our youth are disconnected from a sense of like, what are they gonna do? Like, is the world even gonna be here? Is the earth going to be here? We have killed the earth quite a bit in terms of how we've handled things environmentally. So they see that. And so there's a loss of hope. Like, where is the accountability for our adult population for what has happened so far, and how are we rectifying that to really set up our children and youth for the future? Like, the Whitney Houston song, I believe the children are the future, teach them well and let them lead the way. Like that is at the core of what we need to be doing and focusing on right now, but we have to have a sense of inspiration, purpose, coming together, and then also being really direct. So not avoiding or skating around, not having, assuming that everybody's okay, because they're not. They're not. Everybody's doing the best they can. We are in survival mode, and we've been in survival mode for quite some time. So that's how I'll start. I definitely have more to share, but I'll just kind of put that out there with a different lens and go from there.
Thank you, Mrs. Williams. You guys touched on accessibility, which is an issue, and I know that is an issue for what I call our backpack generation. So if you're out in the community, like I am a lot, you'll see folks in teenager, early 20s, 19, that they walk around the city with their backpacks and they couch surf at their friend's house. And they really have a lot of crisis issues going on. What I've found in recommending places for them, it's like she suggested in the audience, the wait, the politics with getting screened or appointments, or you have to wait to this. When do you guys think it'll be attainable? It's accessible, but when is it attainable for people to actually get those services we need? We know we have a crisis, but they still need what they need.
So part of what she said is that we have to have people there. The reason some of the wait lists are so long is every place that I meet with is hiring and looking for people to fill those spots to try to work with people. And having to go kind of, how do we build people even to hire? We have some who have just left and said, I'm just gonna go into private practice because the work is too hard. I don't wanna sit and meet with, people who are struggling all day, every day. I'd rather do this for a few hours here and then I'll work at Walmart and do something different. So trying to get people into the field, I think we're gonna have to start before college age. How we started building programs in the Syracuse City Schools for people who wanna go into nursing, or who wanna go into firefighting, or who wanna become police. Now we're gonna have a mental health professional track that starts in high school so that we can even get them interested in going up to college. So, I believe there are places, you know, both Helio has open access and, opening the doors 24/7 if we're at the health center, people are trying it, but they also have to have people to work there. And so doing things like this and trying to get people, you know, interested in the field, knowing that it's important, keeping the community. So, one of the things that while someone is waiting to get into professional help, they can still be supported by their community. And so we have to think about what are the natural supports, and we have to be the natural supports out there as well. So if a young person is with their backpack and jumping from house to house, who are they talking to about their issues? Like, while they're waiting to see a therapist, there's still so many adults that are there that should be in their network helping them through things and being able to talk with them about, you know, what's happening with them. We have to be a better support network as the community of adults in our area.
Yeah, you just touched on an interesting point. You know, first of all, you guys are saying that there's a crisis with the number of people who are there to assist in serving the mentally and the addicted person. The interesting thing is that there are a lot of people out there who don't have the so-called degree, but they have the skill set that over time have taught them how to cope, how to help people get through those situations. But the way organization works now is that you have to have a degree in order to do this. And not taking into consideration there are people out there who are gifted that can do it without a degree and get good results. The second thing I wanted to touch on, you know, is trying to figure out what's the root cause of all of this. I mean, poverty has been around forever and a day. I mean, when I was growing up, we were all poor, but we didn't have all these issues that kids are going through today. A lot of, course, is based off of social media, off of TikTok, watching things that have this false narrative that they're starting to believe in. And, you know, as they say, a child's mind is very impressionable. The other thing is that, you know, we really need to sort of look at a different way of handling mental health than what we've had. Because, you know, with from Freud on up through today, you know, there's always that same regimented thing. Okay, if this person's going through schizophrenia, this is how we deal with that, instead of looking at alternative issues on how to resolve that. So.
Just to quickly add on to Mr. Johnson's point as to education, I think when we talk about anything in this world, especially in America, we have to keep in mind critical race theory. This country was founded with slavery. The educational institutions are using the qualified people to give them jobs were the measures used to deem somebody worthy of being a human or a social status. So just because individuals in society don't have access to these educational institutions isn't a reflection of their skill set or talent and ability. It's more so a reflection of how much we've failed as a society, because a person of that potential and skill should be able to get that education. So we need to, as people hiring people and seeking people out, look at ourselves and say, how can I be more equitable in the way I seek out people and I interview people and I hire people? And the other component of, you know, employees and working with people is that remembering that people who are helping people are people themselves. Like, I am very good at helping my clients and my people, but I have my own demons. I have my own suicidal ideations. I have my own shrink and 12-step programs. So the idea is, the best practice out there right now is, at workplace, remembering that you can, just because you can, you shouldn't load onto your employees all the caseloads that you need to get done. You need to remember their humanity and remember that you're responsible for their burnout as well. and engaging in preventive care, which builds into my next point. Mental health has a huge issue. Why are we waiting until people are suicidal to help them? There needs to be a lot more focus on preventive care. Like, Mr. Johnson, growing up, I come from Iran, and Mr. Johnson's time, when there was an issue, there was an elder's house to go to, or an aunt, or an uncle, or a clergyman, or somebody's house to go to talk about issues. Oh, my dad hit my mom. Oh, this and that happened. But as our society has developed, we don't have those kinship connections, those safe circles to share stuff with. So our mental health circles and initiatives need to include those preventative safe space buildings, so the kid can have a safe place to go to when they have something traumatic that happens that day, so they don't find themselves making that backpack, because when something traumatic happens, they know there is a safe space within their block they can go to and get help, so they can find a safe place to go to. So that's incredible that we're thinking about these things and having these conversations. I'm excited.
You know, the other thing I meant to mention is, one of the things with the NAACP years ago used to be each one reach one. And in the healthcare organization is setting up mentorships with patients who have gone through the process, come out of the process, who understands the process, and now utilizing them to help those who are in need. And those are the things, you know, you talked about, you know, how do we get kids involved and thinking about going into healthcare programs, is that when you start talking to a child, you know, who has a parent who's either addicted or who's mentally ill or whatever, is getting that child to understand that, you know, there was somebody here to help your parent. We want you to step in line and come in and help other people, because you know what you went through when your parents were going through that. So, you know, we want you to get involved and get into the program and start helping them. But that mentor protege program is an excellent way to help increase, you know, because some people just don't like going to school, but they have the talent, you know, and utilizing that to get them involved to do things like that.
You're on fire today.
No.
Sweet season. Yeah.
Is it okay to, I want to respond real quick to what you guys shared and share about a resource as well, that the goal is to target exactly that. There are folks that don't like school, and there's also the fact that there are so many individuals out here with amazing gifts and talents and abilities and life experience that might not have access or no interest in education to that degree. So one of the things that Helio Health has done, we have what's called a training institute, and we have implemented a program, actually 2 programs, where there are 2 pathways for individuals to enter the field without any prior really background or experience. One of them is what's called a certified peer recovery advocate. So this is someone that has lived experience. That is the only qualifier that you need in order to work in the field. And so ultimately, anybody that has had a mental health background is a family member of someone that has had an addiction or a mental health diagnosis, or themselves having one. That individual is able to enter into our program, our training program, and then they can get a scholarship to go if they can't afford to be in the program. And at the end of that program, usually it's a pipeline right from that program right into our agency or other agencies that are hiring for that role. So there is a goal to actually meet the need by pulling in people who have experience. So that's one way, and then the other is what's called a credentialed alcohol and substance abuse counselor, so a KSAC, and we have a program for that as well. I believe in that program that there's a desire for a very minimal, at least a high school diploma, sometimes an associate's degree, and then someone can enter into that training program as well. Same thing, they enter into the program, and at the end of it, there's usually a pipeline right from the program into our agency or others. And so knowing that not for everybody is a 4-year or 5-6 year degree, and so that's one of the ways that we're trying to meet that need.
Yeah. Quickly, the point you made about the kids having gone through stuff with their parents,
Right.
I think that's brilliant. I want to kind of switch it up a little. The thing that really worked for me growing up, my dad was a heroin addict and my mom an alcoholic. And one thing that a mentor did for me, they're like, you're brilliant. You're gonna help so many people with the way you've been able to help your parents and take care of them. And I was just like, and I was like 11 or like, I don't know how old I was, but I was like, what are you talking about? This is survival for me. But over the years, as they like continued repeating that to me, I realized the trauma I went through was a gift for me because God was teaching me how to be a healer. So a huge part of the lingo is being able to recognize and honor the gifts we see in the community and voice them in a language that's inspiring and empowering and saying, I see that you have a gift. Would you be interested in exploring that gift? Can I invest in you? And I think that's just brilliant. And a lot of good organizations like On Point and, you know, Better Up are doing that work.
Thank you.
Yep.
I want to share a couple things with you all. According to the National Alliance on Mental Health, 1 in 5 Americans are affected by a mental health disorder. Because of the stigmas associated, many people are left untreated. There are many steps you can take to improve your overall wellness, such as change in lifestyle, and recovery is a reality. You need to think about, does my lifestyle affect my mental health? Several factors contribute to mental health conditions. Some are unavoidable, but there are lifestyle choices that can help prevent mental health issues and promote overall wellness. Some of those were mentioned today. Connecting with others, maintaining a healthy diet, routine exercise is not only good for the body, but really good for the mind. Get a good night's rest. I know that's far and few in between. And speak to a professional. Let someone know how you feel. But I also learned that people will be comfortable with whom they are comfortable with talking to. So going back to what you all say about training, opportunities like Hilio Health, we need to get that more connected with our schools. Opportunities like mental health first aid training. And I noticed Ms. Pierce trains youth. Those are also things that we can do in our community to better understand what the crises are and what people are going through. I want to open it up right now to see if there's any more questions on the floor for the panelists.
So, I get it that there's a shortage, but now in the age of all the Zoom, the telehealth, all of that, I feel like that's a large opportunity to connect that way, because it's not okay to continue to watch while people continue to spiral and use the time-old excuses that, oh yay, we don't have enough people. That healing part, or that at least somebody, that talk therapy part is huge. And having a child who's aging, but she, not so much, 23, but she's struggling with her own mental, I call them mental challenges, but it's bipolar and the like. It is quite difficult because I am not a therapist, and I'm a parent, and I'm a concerned person, and I can help everybody, and I can't seem to just make, culturally she's not connected to the correct person, and then she's transgender. So now you have a layer on top of a layer, and the medications that get to be taken, the imbalance is always gonna be there. So it's extremely helpful to just the telehealth part, for her to reach out and be able to just talk when I just don't get it anymore. I'm just there listening, and so if there were a plan to make it more accessible in terms of telehealth, because even if you can build the insurance and all that, we have great insurance, but we don't have accessibility to correct people to deal with both this and that, not this bipolar or transgenderism. It needs to be both and somehow marry the two. So, I mean, I feel like we're falling off this mental illness cliff or something, and the older she gets, the more concerned I get, because can we do are telehealth options gonna be more available?
So,
And that's for any of you.
well, I want to say before we answer that, Ms. Jackie, one way that we can learn to support our friends and family is becoming a mental health first aider. So that is a training that's open to anyone in the community. I will tell you guys that I am now instructor. So I can work with organizations, I can work with community partners to train people in mental health first aid, which is a 7.5-hour training. But when you leave, you will understand just those things you talked about, the signs, you know, what you should look for. You would understand and learn about other resources that you can connect your individual with. So mental health first aid training is open to anyone. It is done nationally, and I'm also trained by the National Mental Health and Wellbeing Council. So we do have providers or individuals in our area that do offer that training. Sometimes it's a little buried and you can't actually find those people who do it, but I kind of did a little hunt to see what we had in Syracuse, and we do have a vast majority of folks that are youth, adult. There's also a teenage component to the training as well. So if you know of any groups or anyone in the community through Healthcare Education Project, I can offer that now, where we can kind of train you to recognize those things. My love for that came 4 years ago when I came into this position, and we did a summer youth health retreat. Within that retreat, we worked with Abraham Macera, and we brought him in to do mental health first aid with the youth. That was important for the same reasons that you all talk about here. Their peer is going to talk to them first before they talk to another adult. So it was important for me to help them understand the signs and symptoms of a mental health crisis so that they can help be that rescue person in that circle of support that we're missing in our community for their friend. And I will be happy to say that the kids loved it. So we have to start doing more programming like that with them, and also introducing them to programs like Helio Health. And I'm not sure if anyone on the panel wants to also directly answer that question.
So, and I'll let them answer on a clinic end. You were saying if someone has insurance, typically a lot of the clinicians that offer just telehealth or offer a lot of telehealth are private practice, and so it's harder to find them through through a clinic. I do have a list I can forward it to Gwen of Black therapists in our area. Most of them are private practice, but specifically just coming up with who are some of the therapists, and a lot of them do telehealth as well. And so trying to find someone that your family member might connect to better. So they are out there, but it's harder to find when if they're private practice, because it's not as easy to have like a directory of all private practice physicians. But if you have insurance, the only thing is those are just insurance. A lot of times they might not have a sliding fee scale, or they might not take Medicaid, or they might only take private insurance or some private insurances. So it makes it harder, but there are some with telehealth, and I'll let them
And that is
answer.
a good list. I'm on that list too. That's circling around with the Black therapists in the area, and I think it's a really important one to congregate and put all the resources together and share them. And so I want to just share about Helio Health and what we have as well. So since the pandemic, and there's some things that sometimes look like curses but can actually be blessings, that opened up the door quite a bit for many of our regulatory bodies to allow us to provide telehealth services. And at this time, we are still able to provide telehealth services as well. We've also shifted to where we can, if someone cannot get to our clinic to do their assessment, that we have a way to absolutely make sure we can do a telehealth assessment to still admit them. So that's been a big shift as well, of continuing to provide that care. So anybody that's looking for outpatient services can receive outpatient services via telehealth, and even have their assessment be telehealth as well if there are barriers to coming in. We are also getting ready to open. I don't know how many months out it is at this moment because I don't oversee this program, but I am excited to share about it. It's called the Intensive Crisis and Stabilization Center, or ICSC. It's preparing to open on 329 North Salina Street, which is where our outpatient facility is as well. And what that space is going to be, y'all, I think it's the future of mental health. It is a you know how we have like well nows for like urgent care for your physical health, it is like an urgent care for your behavioral health, mental health as well. So folks are able to come in at any time. So we have our open access, but that's when someone's seeking outpatient treatment or inpatient treatment. This is where you don't have to be seeking treatment like longer term. If you are in some sort of a crisis or you need support at any moment, coming in to get stabilized, and the person's able to stay with us for 23 hours and 59 minutes. We just can't have anybody stay for overnight, so over 24 hours. But they could leave and then come right back in if they still need support. And so just wanted to share that that's a resource that's on the way. A couple months out, they're working on staffing it right now, and luckily are getting folks in there, nurses, or psych MPs, our clinicians that are going to be in there, peer specialists, what I was mentioning earlier, people who have lived the experience, case managers, and so forth and so on. And so I'm excited that that's a resource that's going to be available too.
Thank you, Ms. Williams. Dr. Sunny, I'll let you have the last word on this.
Yeah, so telemedicine's here to stay. It's you know, it's here to stay, and that's a good thing. It's complicated, but we absolutely offer both options of face-to-face and telemedicine. We really try to tailor to the patient because, of course, you know, there are different types of personalities, and some folks may avoid trying to have contact with other humans, and that's really important. And the pandemic showed us how important it is to be near other humans, to be together. You know, so it can be a complicated thing with patients when they don't want to come in and see us. You know, it really is important from my standpoint, particularly initially, to be with someone and sit with them and let them get to know us too. It's not just about us getting to know them, but works both ways. But you know, I'm glad you brought up the transgender issue. We see a lot of transgender patients. I'm so glad that people feel comfortable coming to the clinic. It makes me really happy because the suicide rates, the homelessness rates, you know, it's really so disturbing to hear the amounts of sexual assaults, the homelessness, and it's just awful. So yes, we offer the whole range of services. Somebody could call tomorrow or walk in tomorrow, and you will be screened. You will talk to either a therapist or one of our prescribers, and be screened. And you know, so I've got cards here for folks. I've got some handouts about adverse childhood experiences. If anybody would be, please use us. Please come in and use our services.
Thank you, Dr. Sunny. And we'll take one more question.
Really quick, you know, instead of waiting till a child is at teenage age or an adult or whatever, have you guys ever thought about going into the elementary schools? And because the first thing that parents tell their kids, don't talk to strangers. So that sets up the obstacle for a kid to talk to someone when they get older about something. But going into elementary schools and setting up a rapport where kids start to feel comfortable talking with an adult, so if they ever get in that situation, you know. And
Parents, would you like to yeah. So we do have programs in a lot of our schools, starting with, so on the school age children, we kind of focus on social emotional learning and social emotional development. So before getting into some of the more advanced mental health conditions, because a lot of them wouldn't even be diagnosed or diagnosable. It's just having some issues around their social emotional development. So we do have programs in the schools, like Peaceful Schools, that start to do that. What we also have here, part of that, the money came from because of the pandemic. We had schools that have school-based clinics, elementary schools, that have school-based clinics so the family doesn't have to try to go out and get to a clinic, and that it's right there in the school, and they see them during the school day. So they can just come right out of the class, be seen in the school. That's part of my job, was helping schools connect with the clinic so that they could go in there. And it used to be just a few schools. We have 89 of our schools in our county now have school-based clinics, and we're working on some more. If it's up to me, by 2025, I'm trying to have every single school have a clinic in it, and that includes our elementary schools. So that when we talked about how to increase access and increase attainability, so you don't even have to go. You're at school anyway. Here, the parent just has to sign off. Now, the parent does have to sign off if they're under 16, but they can be seen right there, and that increases accessibility. And so that's why we've been able to do that with partnering with some of our great clinics like Helio, Arise, and Liberty.
Thank you. Yes.
So just to build off of that, so before that existed, actually, I went to Lincoln Middle School back in 2012. I was a 6th grader, and my mom was being put in inpatient because she was having issues and she really needed that. And my high school counselor was informed that I was going through a lot at home. She approaches me, she's like, hey, do you wanna have lunch together? I'd love to get to know you. The next thing I knew, once a week, a few times a week, I would get to lunch with her and a few other 6th graders from the school. And we didn't know why we were chosen or anything, and she would talk to us about life and emotions and navigating life, and that just changed my life. She taught me how to start to think about my emotions and what's happening in life, and I got to see that other people go through what I went through at home, or I was going through at home, that I was, my mom was, kind of locked up, and I was in a transitional foster home. But what, really inspires me, yes, we can have clinics, but also, let's train people. Human potential is infinite. I am an absolute believer of that. Why can't we have better professional developments where we teach our teachers and our counselors how to better incorporate language and emotional intelligence components into the way they're interacting with children? And somebody mentioned it earlier, like catching when they say stuff about their mental health and not letting it go. It's the same thing. When the teacher is interacting, if they receive the right training, they know how to use the right words. Like when a middle school teacher taught me to use yet instead of I don't know how to do this. So now when I say, hey, I don't know how to do this yet, you will never catch me say, I don't know how to do this. Because words are powerful and the way we interact with people are powerful. So I love that we have clinics, but also let's empower our professionals, let's take care of them, and let's please not overwork them.
I think we have 2 more questions. I'll let you go and then we'll end with you.
Oh, I was gonna point out that, the 100 Black Men organization they just had a lead prevention or testing program. Upcoming, June 20th, they'll have a gun violence, town hall. Probably you're aware of it or you'll be invited to some of these. And then that, November 14th, a mental health, town hall. So hopefully, we'll see you again at one of those. But, one specific, question about the gun violence there, because of the random mass shootings recently, they're tending to emphasize the need for the shooters in most cases who need mental health services, and I agree with that. But it's also the victims that end up needing it more, even because of the loss of life. So, what are your thoughts on balancing the two, or eliminating the gun violence and suicide by gun issues entirely if we could?
Well, Dr. Sonny, would you take that one?
I mean, what the data says is, the access to guns in this country is far and away the easiest in the world. So we have far and away the most gun deaths in the world per capita. So to me, it's pretty simple. This is what the science says, but we politically in this country, it's, the NRA and the gun rights lobby is very, very powerful. So, we're always gonna be reacting until something changes. And
Right. Thank you.
It's very, very sad.
Thank you, Dr. Sonny.
First of all, thank you to this panel. I just, everything you're saying is so important, and the work you all do. I just wanted to follow up to LaToya's comment about the youth mental health first aid and the mental health first aid training. So, if someone ever wants to do that training and you need a space, I have a space for you. So,
Right.
call me, because that, I'm always looking for ways, how can we give back to the community? And sometimes the barrier is, well, where do we do this? And so, I sent my staff through that training last year. Contact Community Services has, now what,
I
did
did
you
your
train
training,
my
yep.
staff? You trained my staff, sorry, I was about to, cause I wasn't able to attend, or I would have known that, but anyway, and they have a lot of that foundational knowledge that you want people to have that are working in schools, but all the adults are really needing even just the basics reminded, right? Like everybody sort of came out of the last few years a little stunned, if you will, right? Like, what's up and what's down? And so I think we all just have to remind each other of best practice, and that training is such a great way to recalibrate. So, you know, I really encourage people to do it, and if there's a way that we can support making that happen, please don't ever hesitate to ask, because if we can, we will.
Thank you. We'll work with Gwen to see if we can make that happen with NAACP. At this time, I'm gonna turn it back over to you, Gwen,
Okay?
to close us out.
Wow, this was awesome. I wanna thank each one of you for agreeing to participate, and, hopefully we will do this again. All right, and thank you, Laura.
Absolutely.
And
It's a
thank
pleasure.
everybody for attending, and, next time, maybe we'll have more people taking advantage of this, valuable information.